Stress is the process of appraising an event as threatening or challenging and responding to it. Lazarus, 1998. Stress occurs when the pressure is greater than the resource. Typical stress feelings include worry, tense, tired, frightened, elated, depressed, anxious, and anger. There are two types of stressors: internal and external. External: physical environment, noise, bright lights, heat, confined spaces, social interaction, rudeness, bossiness, aggressiveness by others, bullying. Organizational: rules, regulations, deadlines, major life events, birth, death, losing a job, promotion, marital status change. Daily hassles, commuting, misplaced keys, mechanical breakdowns. Internal: lifestyle choices, too much caffeine, lack of sleep, overloaded schedule, negative self talk, pessimistic thinking, self criticism, overanalyzing. Mind traps: unrealistic expectations, taking things personally, all or nothing thinking, exaggeration, rigid thinking. Personality traits: perfectionists, workaholics. Types of stress: negative and positive. Negative: contributory factor in minor conditions such as digestive problems, headaches, skin complaints, insomnia, and ulcers. Excessive, prolonged, and unrelieved stress can have a harmful effect on mental, physical, and spiritual health. Positive: stress can also have a positive effect, spurring motivation and awareness, providing the stimulation to cope with challenging situations. Stress also provides the sense of urgency and alertness needed for survival when confronting threatening situations. The individual. Everyone is different with unique perceptions of and reactions to events. There is no single level of stress that is optimal for all people. Some are more sensitive owing to experiences in childhood, the influence of teachers, parents, religion, etc. Most of the stress we experience is self-generated. How we perceive life, whether an event makes us feel threatened or stimulated, encouraged or discouraged, happy or sad, depends on a large extent on how we perceive ourselves. Self-generated stress is something of a paradox, because so many people think of external causes when they are upset. Recognizing that we create most of our own upsets is an important first step towards coping with them. Endocrine system. Stress response is controlled by the endocrine system. Demands on the physical or mental systems of the body results in hormone secretion, adrenaline, and testosterone. Endocrine system responses: increased pupil dilation, perspiration, increased heart rate and blood pressure, rapid breathing, muscle tenseness, increased mental alertness. General adaptation syndrome. Adaptation, exhaustion, management. Alarm response. This is the fight or flight response that prepares the body for immediate action. Adaptation phase. If the source persists, the body prepares for long-term protection, secreting hormones to increase blood sugar levels. This phase is common, but not necessarily harmful, but must include periods of relaxation and rest to counterbalance the stress response. Fatigue, concentration lapses, irritability, and lethargy result in the stress turns negative. Exhaustion. In chronic situations, sufferers enter the exhaustion phase. Emotional, physical, and mental resources suffer heavily. The body experiences adrenal exhaustion, leading to decreased stress tolerance, progressive mental and physical exhaustion, illnesses, and collapse. Symptoms of stress. Let's physical symptoms, mental symptoms, behavioral symptoms, emotional symptoms. Physical symptoms: sleep pattern changes, dizziness, fainting, digestion changes, loss of sexual drive, sweating and trembling, tingling hands and feet, headaches, breathlessness, aches and pains, palpitations, infections, missed heartbeats, and indigestion. Mental symptoms: lack of concentration, memory lapses, difficulty in making decisions, confusion, disorientation, and panic attacks. Behavioral symptoms: appetite change, too much or too little, eating disorders, anorexia, bulimia, increased intake of alcohol and other drugs, increased smoking, restlessness, fidgeting, and nail biting. Emotional symptoms: bouts of depression, fits of rage, tearfulness, deterioration of personal hygiene and appearance, and management. Stress-related illnesses. Stress is not the same as ill health, but has been related to such illnesses as cardiovascular disease, immune system disease, asthma, diabetes, ulcers, skin complaints, psoriasis, headaches, migraines, premenstrual syndrome, and depression. If it's curable or not. Stress isn't a diagnosis, so there is no specific treatment for it. However, if you're finding it very hard to cope with things going on in your life and are experiencing lots of signs of stress, there are treatments available that can help. These include talking treatments, medication, ecotherapy, complementary and alternative therapies. Biological factors. Transgenerational stress inheritance is the transmission of adverse effects of stress exposure in parents to their offspring through epigenetic mechanisms. Stress induced epigenetic changes, particularly to the genes that affect the hypochondrial thalamic pituitary adrenal HPA axis, persist into future generations, negatively impacting the capacity of offspring to adapt to stress. Early life experiences, even when generations removed, can cause permanent epigenetic modifications of DNA, resulting in changes in gene expression, endocrine function, and metabolism. These heritable epigenetic modifications include DNA methylation of the promoter regions of the genes that affect sensitivity to stress. Stress can also result in inheritable changes DNA methylation in the promoter regions of the estrogen receptor alpha, ERA, glucocorticoid receptor, GR, and mineralocorticoid receptor, MR. These changes lead to altered expression of these genes in offspring that, in turn, leads to decreased stress tolerance. Medication. Feelings of stress are a reaction to things happening in your life, not a mental health problem, so there's no specific medication for stress. However, there are various medications available which can help you reduce or manage some of the signs of stress. For example, your doctor might offer or prescribe sleeping pills or minor tranquilizers if you're having trouble sleeping, antidepressants if you're experiencing depression or anxiety, medication to treat physical symptoms of stress such as IBS or high blood pressure. Treatment. Talking treatments. Talking with a trained professional can help you learn to deal with stress and become more aware of your own thoughts and feelings. Common types of talking treatments which can help stress are cognitive behavioral therapy, CBT, which helps you understand thought patterns, recognize trigger points, and identify positive actions you can take. Mindfulness stress reduction, MBSR, which combines mindfulness, meditation, and yoga with a particular focus on reducing stress. Ecotherapy. Ecotherapy is a way of improving your well-being and self-esteem by spending time in nature. This can include physical exercise in green spaces or taking part in gardening or conservation project. Complementary therapies. You may find complementary therapies help you manage feelings of stress. These might include yoga and meditation, acupuncture, aromatherapy, and massage.
Do you know what stress is?
I think stress is about like a dreadful feeling that you have that makes you feel anxious, that hinders your ability to do things, and you don't think correctly and all that stuff.
Yes, I know what stress is. Stress is an emotion that just complicates life a little bit too much. Uh, it either helps you put you on track or it prevents you from doing day-to-day activities, and it just overall makes your days worse.
Do you know the different types of stress?
Probably school and then family. Opinion, stress can be for work, study, or social problems that you have.
How often would you say you experience stress?
I would say I experience stress on maybe an everyday basis. I feel like it can happen to anybody, and especially me more so. Like every little thing that gives me anxiety can be classified, at least to me, as stress, even if to most people it just might be a minor inconvenience.
I could say that I am the definition of stress. I'm one of the most stressful people that I know. I deal with stress with my family. I'm an international student, so I miss the people from home. I have a tough time interacting with people. Stress can come from work. Uh, Stress from the lack of work. 'Cause as an international, it's hard to get jobs. There's so many ways to get stress.
What causes the most stress in your life?
College student, probably a lot because it's either I have like an assignment that's due and I'm like, okay, I gotta figure out how to do this. What is happening? Oh no, I'm gonna like fall apart. Or I also play games. So if I'm playing a game and I lose a game, then that stresses me out because then it might trigger that I'm gonna lose more games. So I'd say pretty much every other day I'm stressing out about something.
I'm stressed. I usually don't have the feeling to eat because I'm like in a bad mood.
Affect me because it would be hard to focus.
How does it affect your school and work?
Well, the thing that causes me stress is schoolwork, and how does it affect my school and work? Very badly. because I have mental breakdowns.
It affects it by maybe avoiding it, some assignments, or just slacking in work.
How much does it usually affect you emotionally and physically?
Physically, it affects me with my general self-care. Sometimes I don't feel like doing anything. I would rather stay in the house, stay in my room, not even take care of myself. Eating, I usually stress eat. Fast food is the easiest thing to turn to. Emotionally, it might shut me down during some days. Normally, I'm a very talkative person, but sometimes it just shuts me down, and I don't want to deal with anyone.
Stress affects me physically, as in, well, maybe more so right now, but I guess it's anxiety. I don't speak clearly. I mean, I take a while to think of things and then I say them. My body might shake. I don't speak directly. I might like put my hands in my pocket, that sort of thing. Emotionally, I overthink a lot, that type of thing, and I don't know, just a lot of things go in your head that you really don't. You make up things that aren't there. So yeah.
How stress affects your interaction with family and friends?
It affects my interactions with family and friends because pretty much when I'm stressed, I get easily irritated. I'm like annoyed by the little stuff. So sometimes when I'm really, really stressed, I kind of put my anger towards onto them. So that kind of affects me in the negative side.
When my family causes me stress, I'm mad with them. I don't talk too much. But when I'm with my friends, it's totally different because they make me laugh. It's different.
Do you feel burnt out, depressed, or anxious? Why?
Maybe depression and anxious sometimes, because when you feel so burnt out and too much stress, you just feel like you don't want to do anything and just, avoid everything.
What ways do you use to reduce stress? How do you cope?
Honestly, sometimes when I'm stressed out, I just like take a break. So I just like stop doing some things. I sit down, play some games, or I just go on my Spotify and just start listening to Broadway musicals. Because like, I don't know about whoever's watching this, but I like to go to a song and like hype myself up. So like I will play a song and I will play a song that I know really well so I can sing the lyrics to it and just start getting like really lit and like hyped up about it. That's how I kind of go with stress.
Reduce stress by since I really don't have the time to like do my hobbies, I just like sleep it out, take a nap, or like take like a 15-minute break from everything. Because pretty much like what I said in the beginning, school causes me stress. So if I constantly keep doing schoolwork, I take like a 15-minute break, just like not do anything, not being on my phone, just like complete silence, kind of like helps me calm myself down and reduce stress.
Yeah. Have you ever gotten help from my professionalist?
I never get help from the stress, except for myself.
Have you ever talked to anyone regarding to the stress you have?
No, because that gives me more stress because I think that will inconvenience them.
I don't really get any help from people because I like to be independent, and a lot of times when I tell people that I'm stressed out about something, yeah, they'll talk about it, but in the end, they don't care about it. And honestly, as I'm talking to somebody, I lose interest in my stress. Like, I don't care about it.